So the question was, what are the National Guard from Fred Knapp, what are the National Guard specifically going to be doing at the dormitories, and why is it necessary? So what the National Guard will be doing is actually providing that security. Again, we're asking people to isolate and quarantine, which means we don't want other people coming into those dorms, so they're going to be preventing people from going in. And then also, again, those folks will generally need to be able to take care of their daily activities on their own. But if they need other help or some direction or something like that, the National Guard would be able to provide that. I believe they're also going to be taking the temperatures of anybody who goes into those dorms to, again, just make sure that we're monitoring the health of folks that are coming in and out of that. And as I said, it will be staffed 24/7. So the number of National Guard soldiers there will really depend on what it takes to be able to do that. And then Dr. Antone, I don't know if you had anything else you wanted to add to that?
Yeah, the National Guard has been great partners with us in this situation for the dormitories. They'll actually be nurses, medical assistants, and even mid-level practitioners such as PAs and nurse practitioners on site. The mid-level practitioners will be on site during the daytime hours, and then nurses and certified medical assistants will be there 24 hours.
Those are Guard members?
Yes, they'll be National Guard members, and this is for the first 2 weeks and maybe even a few days longer if necessary, until we get our staffing up for basically general population, people coming in to staff those areas. There'll be a medical director in addition, and then since I'm a doctor, I'll be available too for any advice should patients specifically in isolation start feeling symptomatic so that they might need hospitalization, so we can either assess them personally or make the assessment that they need to be transferred to a hospital. So again, National Guard, great partners in this to get this rolled out.
Is it starting today?
Yes, I think it starts tomorrow.
A lot of those dormitories, at least ones that I've been in, have shared bathrooms, shared dining facilities. How do you separate everybody in regards to those facilities?
The dorm rooms that I've seen all have their own separate bathrooms, and food will be provided by the university, as well as laundry services, I think, are set up, janitorial services, and as the governor said, National Guard will provide the security.
I think it's important to note, even where there's room, Dr. Antone, there'll only be one person in each room.
Yes, one person in each room, yes. No social gatherings.
So the plan is to use a lot of the newer dorms that have the single bathroom?
Yes, these are the dorm rooms that are on the Dodge Street campus. So the National Guard is there now. They were there yesterday, and they're there today and again tomorrow. And they'll be obviously testing the people that are at higher risk, but they'll also be testing some of the community that are also maybe exposed. So those will all be done through the contact tracings that the public health and another epidemiologists have done. Did you want to add anything?
Do you have another question for Dr. Antone?
Well, I was curious as to whether you have any indication yet of what the demand may be for these dorm rooms. Whoever wants to take that.
I can take that, and the question was what do we anticipate the probably the volume that we'll be getting as far as taking advantage of the quarantine and the isolation rooms at the specifically University of Nebraska-Omaha now that we're rolling out? Well, at first when we rolled it out for the EMS and the healthcare workers, so we didn't see a lot of volume, but now we're up to, I think, 18 people taking advantage of that situation. So I think as word gets out and people know that it's available for them, I mean, obviously it's out there to protect their loved ones and their other personal contacts. And so we just thought it would be a service that'd be available to help those people that really can't self-isolate or quarantine at home. But you do need to perform your own daily activities in order to take advantage of these dorm rooms.
What does that mean?
That you don't need assistance bathing or feeding yourself, things that you might see a need for in like a skilled nursing facility or a long-term care facility. And we're working on areas for that too.
And what's the capacity? You have 18 now, you can take up to?
Well, there's 18 people that took advantage of the healthcare worker situation. I think we have the capability of 200 rooms at UNO, I'm pretty sure. and even more in Lincoln, and I think even more, I think there's 400 in Kearney when that's necessary.
So 200 dorm rooms at UNO.
And 400 in Kearney and 20 in Lincoln.
I think it's even up to 600 if necessary.